Ladies and gentlemen, we will begin in a few seconds from now. In the interim, may I request you to kindly share the link with your family and friends all across the world. This show is not just for those who are 60 plus or maybe 50 plus, but for the younger generation as well, so that they are able to understand how to deal with elders. Feel free to share this link with family, with friends, all of your other colleagues of all age groups. We will begin in just a few seconds from now. Good morning, ladies and gentlemen, and welcome to the second virtual Knowledge Worth Having series organized by the Catholic Gymkhana Limited. Ladies and gentlemen, as advised at our first session last month, these talks come to you live this morning using two platforms of communication, Zoom and YouTube. With technology having advanced, thanks to COVID, of course, this is only the second time that we're using an integrated dual medium of communication. The talk this morning is broadcast using Zoom, while you, our viewers, are able to see it on our own dedicated Catholic Gymkhana YouTube channel. Manning our control room this morning is the very dependent Ian Pereira and the ever-reliable Aubrey Chatelier, who have collectively put in many hours of hard work to make this happen. Before we begin, let me caution you, ladies and gentlemen. By any chance, if we do lose internet connectivity at any time during the session, please do not log out, continue to hold on, do not switch off. The speaker losing connectivity, that is either our speaker or me as your compere and host, if we do lose connectivity, we will be with you in a few seconds immediately thereafter, but continue to stay logged in. So what really can we expect this morning, ladies and gentlemen? Over the next 100 minutes, we will begin off with the President's introduction of the speaker. That will be followed by a discussion with our speaker. Thereafter, we will entertain questions from our viewers. And finally, we will end with the vote of thanks. I'd like to encourage you at this time, ladies and gentlemen, to invite your children, your middle-aged people, your other friends who could be caretakers to listen to this talk. I'm very sure it's going to help them as well. I also like to remind all our viewers that at the very end, our speaker, Dr. Prem, will be answering questions from the audience. May I remind you that those of you who are interested in sending in your questions, please ensure that you get onto the Catholic Gymkhana YouTube channel chat box. Record your questions out there in the chat box. Our control room will collate all of these questions together, and we will pose these questions across to our speaker this morning. Ladies and gentlemen, we are all set to go, but before we begin, I'd like to call upon our President, Mr. Vernon Miranda, someone who encourages both these talks as well as the virtual musical show that we have every Saturday night. Ladies and gentlemen, I give you our President, Mr. Vernon Miranda, to introduce our speaker this morning. Over to Vernon.
Thank you, Sanju. Our speaker today, Dr. Naganath Narasimhan Prem, Dear members of the Catholic Gymkhana, guests, ladies and gentlemen, greetings to one and all. It gives me great pleasure to welcome you all to our Knowledge Worth Having seminar today, the second event in its virtual mode and 10th in the series. It is a happy moment to extend our warm wishes on behalf of the Managing Committee of the Catholic Gymkhana. I am delighted to see such good numbers in the house. A big thank you to each and every one present here for joining this program. Pre-COVID, the medical talks arranged by us at the Catholic Gymkhana Hall had touched the pinnacle of success, with over 300 people participating in the programs. Your participation and support encouraged us to approach prominent members of the medical profession to enlighten us in various fields of medicine. Members had evinced keen interest in gathering knowledge in the field of geriatrics and elderly care. Our senior member and my good friend Roger Pereira was prompt in suggesting to me the name of Dr. Prem to address this topic. Thank you, Roger, for providing me with the connect to Dr. Prem, who was to address our members in March 2020. COVID struck the universe, and consequently, we have come back after 15 months to bring Dr. Prem on the CG platform to address this subject. Thank you, Dr. Prem, for accepting our invitation. I would also like to express my appreciation and thanks to SANJU Fernandes, Ian Pereira, and Aubrey Chatelier for their support to host this virtual talk. Dr. Naganath Narasimhan Prem is an experienced geriatrician who heads the Department of Geriatric Medicine at one of Mumbai's premier hospitals, the Jaslok Hospital and Research Center, a leading multi-speciality hospital. Dr. Prem did his MBBS from MGM Medical College, Nashik, and his MD in Geriatric Medicine from the Amrita Institute of Medical Science, Kochi. Dr. Prem is a member of the Research Wing, Indian Academy of Geriatrics. As we all know, geriatrics is care for the elders. Dr. Prem's team includes experienced and caring professionals who share a belief that care for the elderly should be comprehensive. As a consultant of repute in geriatric medicine and an elder care specialist, Dr. Prem's areas of expertise are geriatric medicine, pain and palliative care, multi-morbidity management, dementia, and cognitive assessment. Positive mental health is a very important factor for aging gracefully. The topic of Dr. Prem's presentation this morning is Life Can Be Worth Living at 60 and Above. Dr. Prem will enlighten us on ways in which geriatric medicine can help the elderly to cope with distress of isolation, retirement blues, improve mental well-being, and ways to stay engaged and connected. With Dr. Prem's experience, we elders will positively benefit by adding life to years and not just years to life. I am sure the seminar will be beneficial and fruitful for everyone who is present here today. Ladies and gentlemen, it is my privilege and pleasure to present to you our Honorable Speaker, Dr. Naganath Narasimhan Prem. Thank you.
Thank you very much, Vernon. Ladies and gentlemen, we will now deep dive to our speaker, Dr. Prem. Firstly, thank you, Dr. Prem, for being here with us this morning. It is an absolute pleasure to have you with us. Welcome to the show.
Thank you.
Let me start by putting this discussion in context, Doctor. We all know that this is India, in fact, has a very large population of 1.3 billion. In fact, as we speak, probably 1.4 billion people. Statistics and news feeds tells us that we are predominantly a young, vibrant population. Against this background, is the Indian population really aging, Dr. Prem?
Yeah. Good morning, everybody. And thanks a lot, Mr. Vernon, for that excellent introduction of me. And thanks a lot, Catholic Gymkhana, to have me here. We are a young population, but we are an aging population, which is vibrant. So I think that is what I would want to add to what you said. If you delve into statistics, almost 12.5% of our population is expected to be of geriatrics as far as 2026 is concerned. And that is going to get it to 20% as we go into 2050. So what are we looking at? I am not quoting statistics to scare anybody or to say that it is very less or very more. We need to be prepared. There are more and more people who are actually living well and living well older. But at the same time, there is a lot of medical issues as you grow older. So for the overall care of older people, we need to have better facilities. We need to be more prepared as far as human resources are concerned. That's why for the overall betterment of the mental, physical, social, psychosocial, as far as older adults are concerned. So the silver tsunami is coming. But at the same time, we need to see that we be prepared for the overall mental and physical well-being of the older adult.
So, Doctor, what would you say is the importance of one's health as you get older? You know, what really is the importance of one's health?
Yeah, on that topic, this decade itself has been dedicated to healthy aging. So the decade from 2020 to 2030. Unfortunately or fortunately, it started with COVID. Now, why I would say unfortunately, unfortunately, because the number of older adults were affected a lot. But it also gave us that challenge to actually think how we can address older adults better and how we can think of their health better. So what makes you independent or dependent? Not every older person is the same. Some might require the help in everything. For example, even in bathing, even in dressing. But some, if I have to quote an example, like if you see Milind Soman's mother, Usha Soman, she actually runs marathons and she's well over 70. So not everybody is same. But what connects these things? That is health. So health is very important for you to connect yourself from being from the medical part as far as concerned, for being physically fit at the same time, and overall for you to age better. It's very easily said and done. Yeah, I want to age well. I want to be well. But one has to make sure that you age gracefully and health has to be taken care of. Just on that topic, I think I can sort of pull up a slide for that. I hope you can see my slide.
Not come up yet, Doctor. We're waiting for the slide.
Okay.
It will be up in a few seconds, I'm sure. Okay.
Okay, there we are.
Yeah. Yep.
So it's very easy to say that health is important, but as an older adult, you need to know what actually affects your health. So one is what you are actually having internally on your individual side. And one is, of course, the external environment that you live in. So if you see internally, it's your behaviors, it's your lifestyle, how you're actually eating, the amount of water you drink, the amount of exercise you actually do, whether you have any activities, extracurricular activities, which I call like the amount of drinking, the amount of smoking you do, whether you're actually taking too much of oil in food. So all these things matter as far as your behavior is concerned. Secondly, you have to remember that your body complements you for years together. So if you're 90 years now, so from 9 months in the womb and coming, you have always been aging. So if you're a 90-year-old, your body has taken all, you can say, all the efforts to be fit. But as you say, in a beautiful, you can say, vintage car, there are obviously certain chinks as far as oiling is concerned. So you might have weaker knees, you might have age-related changes in almost all the organs. So you need to remember that that is the key. You need to know that there is an age-related change. Then genetics. I mean, there are a lot of diseases where genetics or genes matter a lot. For example, if there is something in your family, like if somebody has diabetes, somebody has hypertension, somebody has a history of stroke, somebody has a history of heart disease, you need to know that you have to be careful. At the same time, if you are able to sort of make sure that you are taking precautions and get yourself checked. Disease. I would love all older people not to have any disease at all. But unfortunately, with one disease, sometimes comes another one. For example, if you have a diabetes, you might have a hypertension, you might have cholesterol. So everything comes together. So the lesser the disease, the better. The more the disease, you have a chance, obviously, of not aging well. Then the environment that you live in. I think housing is very important. Where you live, which floor you live, you have bad knees, you're living on the first floor, and there is no lift. That is a concern for me. You might end up not going out at all because of actually thinking that you might have to drag yourself out every time through those humongous steps. So that is something which might keep you away from public at all. Assistive technology. I think it's very important that older adults accept it. By acceptance, I mean you do not get dependent on using a hearing aid. You do not get dependent on spectacles. You do not get dependent on using a stick or a walker. Remember, using them makes you more independent. So that is what you need to see. If you don't use it, you can't hear. If you don't use it, you can't walk. So I think if you keep the attitude that assistive technologies help you rather than making you dependent, I think that is very, very important. Transport, yes, we are getting there. Internationally, if you see, the transport is very well taken care of as far as older adults are concerned. India is getting there with more and more facilities getting better. But I think that is important because for older adults to get out, not everybody will have their own car. So public transport is very important, very crucial. And there are a lot of older adults who will not want to drive. They just want to sort of use public transport because they want to enjoy what they're doing rather than focusing on driving and doing others. One of the most important things I think in anybody's life is the social facilities. As I said earlier, health is a state of physical, mental, and social well-being. So for example, even in Catholic Gymkhana, earlier people used to connect individually in person. Now it is online. So you need to have, maybe it's a club, maybe it's a cookery club, maybe it's a club in which you are actually doing something, maybe it's a club where you just come and express. Then whether you go to play tennis with people, so that social factor is so important. Your friends, your family, all those things matter a lot, and it indirectly affects you as far as your health is concerned, because you might have seen in COVID, social distancing was a problem, but people somehow went into social isolation.
Well, Dr. Prem, you and I both know we are a very heterogeneous population. We all know that. Then how exactly are adults different in this environment?
Yeah, as far as older adults are concerned, there have always been, unfortunately, myths. People have just dragged that all older adults have memory issues, or older adults might have a low mood, or older adults cannot learn. I mean, these are myths actually older adults bust every day in every occasion. So that's why I feel that some certain factors matter. Why is every older adult so different? One is, of course, when you were younger and a stressor came, for example, you're doing fine and then you get a cough, you get some symptoms, you get a pneumonia, your recovery period is much more lesser as compared to a older adult. But when you're older, your ability to deal with an external stressor might be a bit more difficult. It might take time, but your body does get adjusted. So that is one thing. Second is nothing, 2 plus 2 will not be 4. It can sometimes be 10. So if an older adult comes to an emergency just talking gibberish, then I might realize, no, it's actually a pneumonia, or it might be a urinary problem, urinary infection, which is very common. But in a younger adult with pneumonia, I will get cough, I will just get fever. So, I mean, the presentation is very typical as far as older adults, as far as younger people are concerned, but older adults have a typical presentation. Then disease. More the diseases, more it becomes challenging for us. Lesser the disease, yes, of course, it is much easier for us to deal with older adults. Then I think attitudes matter a lot. Now, attitudes of the older adult themselves, and of course, attitudes of their relatives. I will take up the attitude of the relatives first. We as caregivers, we as relatives want to take care of our older adult to the hilt. And we always mean good. I don't feel that we don't mean good at all. But sometimes we might cut them off from things which they actually want to do. I'll quote you an example. A homemaker who might be 80-year-old, but she's not physically dependent. She has hardly any health issues, and she loves to cook. But a son and a daughter-in-law might just say, see, we are there, we have servants, they'll cook for you. So why do you have to keep doing it? You just rest. No, I don't think that's the right way of dealing with it. We should encourage them to continue doing it, because we might actually be stopping them from doing something which they're so passionate about. So that is something which we should keep in mind as far as caregivers are concerned. Now, the attitude of the older person themselves. Sometimes that's what Mr. Vinon had just mentioned, retirement blues. Sometimes before retirement, there is strict planning. I'm going to go here. I'll have a lot of time. But just when it strikes at 60, and suddenly people are like, oh my God, I don't know what to do. And there have been research which says that immediately post retirement, people have actually been sort of really go into a hole in which they don't know what to do. So that's why prepare for your retirement. Most older adults, let me be very frank, are positive about, because they feel that they will get time to do a lot of things they couldn't do. But for some, it just suddenly strikes. Then social issues. I think an older adult fit, having all the money in the world, but isolated, no children, nobody to talk to, no companions. That is a significant social issue which will affect their sort of overall health. Then treatment challenges. I think in an older adult, treatment cannot be as easy, purely because one medicine, if I give, that can have an interaction with an aging health, with an aging body, with the disease per se. So it becomes much easier. So it has to be more organized as far as we dealing with older adults is concerned. Then, of course, one of the most important thing is geriatric syndromes. Uh, Challenge being something like people having dementia, depression, even urinary incontinence, falls. So all these things might suddenly come in an older adult, and they are taken aback, and treating them becomes quite difficult. So ultimately, as older adults, we should see that you are unique in every way. But at the same time, there are things which matter to you, which should be taken a closer look as a geriatrician.
Very interesting, Doctor. In very simple terms, what exactly is geriatric medicines? And typically, at what age would geriatric medicines cater to? Is it, that there is a certain time limit within which geriatric medicine would come into play, or are there some certain signs? When exactly would it come into play, Doc?
Yeah, in medicine, we are always, you can say, or as in anything, we are very much interested in history, because multiple timelines there have been, history is created. So as far as geriatrics is concerned, the great Ignatius Leon Asher, he is the one who actually thought that there is pediatrics, where specialized care is there for the older adults. So why not for elderly? Or older adults, because older adults actually need that care. They need a more organized care. They have specific problems. So he coined the word geriatrics, which was obviously from Latin. Geros means old age and itrikos means healer. So this was coined in 1909. And what per se is geriatric medicine as a branch? Because I think that is also very important. It's a branch which is concerned with diagnosis, treatment and prevention of disease in older adults, but keeping in mind the problems specific to aging. Now, the reason why I'm saying this, I quoted prevention as well. As we get older, we always keep thinking now it's only about treatment of diseases. No, at any age you can prevent disease. For example, if you're smoking, you stop smoking at any age, the risk of cancers, the risk of lung diseases with smoking will only decrease. Secondly, if you're actually vaccination, I think prevention through vaccination has never been more prominent than this particular COVID era. But influenza vaccines and pneumonia vaccines have been educated even earlier. Not all older adults have been really susceptible to actually taking the vaccine as well. So that's why prevention is also very important. Now, if you see about the age group part, now, of course, overall abroad, 65 was always taken as the age, but in India, the retirement age has always been 60. In fact, in certain cases, retirement has been even 56, 58, which was, of course, earlier. So 60 is the age usually where we start looking into older adults. And there is always a classification in the age as well. One is, of course, 60 to 69, which we call our young olds. 70 to 79, which we call our middle olds. And more than 80 is what? Which we call our older olds. But what we know is ultimately, as we have seen on the Okinawa diet, where in Japan, there is an entire island which has centenarians. So I see that in the foreseeable future, with health improving, we will change those age limits, and maybe we might even have the last old as more than 100.
So, Doctor, what exactly or how exactly would a geriatric or an elder care specialist help an older person? In what different ways would you be able to help someone like you?
Okay, so who is a geriatrician, I think, or an elder care specialist? Now, it's basically a doctor who is specifically trained to evaluate and manage the unique healthcare needs and the treatment preferences of older people. Now, what do I mean by that? By that, I mean that in an older adult, usually we cannot only think about the fact that no, this is the particular form of treatment. We might have to discuss the treatment preferences. How does that work? One is, for example, if somebody has very bad knees, a person does not want to go for surgery, and then the older adult asks me, can I just put a bit of oils? It will actually help me in improving my symptoms. So that is perfectly okay with me. I mean, I would not say that no, you should only take painkillers, or you should only take painkillers, or you should just stick to what I have told you. No, if those things help them, because we need to understand the treatment preferences, because ultimately not everybody can afford a knee transplant, but at the same time we need to make sure that we are able to take care of the symptoms. Now, to deal specifically, an elder care specialist, as I already mentioned, has to deal with geriatric syndromes. Now, an older person might actually have a memory problem, might be depressed, might have a urinary incontinence, have a history of falls, might have become bedridden because of the same, might be constipated, might be immobile. These are all geriatric syndromes. And ultimately, an older adult will present to us like that. So our job as a geriatrician is to delineate all these things and make sure that whatever we can improve, and make sure we can get them to that previous quality of life that the older adult actually had before. Now, if you see that there is something known as a geriatric vicious circle. So these syndromes can present so quickly and together that if you don't handle it, then everything will be there in an older adult, and it becomes difficult for us to stop it. So recognition. So an elder care specialist is able to recognize this better, and basically, like how in pediatrics, is able to give age specific advice along with taking aging into the mind. So as a geriatrician, as an elder care specialist, I think giving time to an older adult is very important. Getting everything from them, including the things which they do, the hobbies they like, matters a lot.
How would you assess an older adult, doc, in that case?
For assessing an older adult, I think we need to sort of see what factors affect an older adult's health status. So I think maybe it would be better if I could show it through a visual.
Sure, sure.
So just sharing.
Sure, Doc, take your time. I'm sure it'll be up in a few seconds.
I hope.
Oh, there it goes.
I
Yeah.
hope, Mr. Sanju, you can see.
Yep.
So as you see here, in center is the health status of an older adult, and towards the extreme right, and it would be towards your left, medical conditions are important, but apart from that, also matters is the functional status, how independent they are, their memory, the affective status, that is what is the mood, is there any anxiety, is there any depression, social support. I think social support matters a lot, because who is going to take care of the older adult if there is an emergency? What is their backup? Is there any friend, is there any family who is involved? Economic status, again crucial, because it helps us in deciding treatment plans. Environment, as I told you earlier, both internal and external. And spirituality. So if you see, it's a multitude of factors which actually takes care of the health status rather than only the medical conditions. And how do we sort of do it? How do we assess? So when we go assessing, we actually assess it this way. So this is something known as a geriatric assessment, in which we try to, of course, get the symptoms. So obviously a detailed history will sort of be taken. Then a nutritional assessment, a physical assessment, thorough assessment, then a quality of life, which is the functional part, a detailed social history in which everything from your hobbies to even thinking what you're actually trying to do, what are your plans post-retirement, who is living with you, what is your financial capability, what would you want to do, how would you want to contribute back to society, environment, both internal as well as external, then the memory as well as far as effectiveness is concerned, the effective assessment is concerned. Now, just delving onto it a bit more, as we saw, something known as a multitude way of seeing an older adult. So this will not be done alone. Sometimes it needs certain team members. It could have a trained nurse. It could have a social worker, if and when required, a physical therapist, a nutritionist. Then, of course, if you have specific diseases like a heart or maybe even a kidney, then you might need a cardiologist, a nephrologist. Then, of course, three things which are very important in an older adult. I think eyes, hearing, and teeth. So at any point, maybe an ENT specialist, an ophthalmologist, and a dentist, because those things matter a lot. And as I told you that to maintain quality of life, we as a team might need that help. Then of course, what else is sort of involved as far as older adult is concerned? One is, of course, your quality of life. So there is something known as basic activities of daily living. So what are your self-care tasks which you can do? Bathing, dressing up. Then instrumental activities of daily living, which is basically maintaining an independent household. Are you able to cook yourself? Are you able to maintain your finances? Are you able to take your drugs? Then advanced activity of daily living is what I like, because if somebody is doing that, for example, ability to fulfill your society, your family roles, then participate in recreation. Then another thing which we do in an assessment is, as I told you, the safety of the home environment, whether there is too much of clutter, what is the lighting, which floor do they live in. Socially, very important, what is the relationship with friends, family, what is the living arrangement, then the personal support system. Then if there is there any caregiver burden, then visual and hearing basic assessment, because it's very common. Then memory impairment. I think the reason being, once we know that their memory is okay, most older adults are also pretty at peace. So I think it's always better for an older adult to screen for their memory. Depression can easily be missed, because if you don't ask for it, an older adult might not say it. So just very simple questions like, have you been bothered? Do you feel down? Have you feel not liking doing things in the past few months? So that can help us. Then I think medicines is one of the things that older adults dread, but at the same time they have to be looked into. Sometimes there is overutilization. At one point, I had a patient who had 30 drugs. So all I needed to do was reduce slowly and steadily, and the patient got better. There's something known as a prescription cascade, in which maybe just treating a side effect of a medicine can obviously be an issue. I have certain issues also with attitude towards treating older adults with medicine. Sometimes it is it's an underutilization. Oh, a person is an 80-year-old. Do we need to treat? No, just age. No. If the person is 80-year-old fit, then obviously I should be treating. Then of course, urinary incontinence, which again is something people have a great taboo in mentioning, because if you miss a urinary incontinence, a person might just fall off in their own urine and you won't even know. Uh, it causes a lot of social issues, because ultimately an older adult would not want to go out if they have a fear of actually getting wet. Then a balance and a gait of a person is very important. So that is also seen. A nutritional assessment, yes. So overall, as far as the assessment is concerned, is try to make a problem list and try to sort out every problem, not only for immediate care, but a continuum of care, not only at the OPD, in the admission, but hopefully getting an older adult back into the community, if not in the earlier way, but at least in the same way.
Some of the domains that you had put up there, Doctor, for a layperson like us, it could be a bit technical. Would you be able to give us some examples to help us better understand some of those domains that you were explaining?
Yeah, of course, as we deal in our daily practice with older adults and we assess them, to be very frank, we learn much more from them than with their experience. But then there are certain ways when we look at them, we are able to unearth things which we might not be usually. So in case in point, an 85-year-old woman who just had uncontrolled hypertension. So she was just on one blood pressure medicine. So she went to her local doctor, and it was another blood pressure medicine was just added. Fine, your blood pressure was 170/90, so just take another medicine. Unfortunately, 2 weeks later, she actually had a fall. So once she had a fall, that is when we got involved and she came to us. So on further probing, we realized she lives alone. Doing a comprehensive assessment, she has a gait and balance abnormality. She actually had issues with bone health. All of you must have heard of osteoporosis. She had a mild memory impairment. She had an incontinence of urine. The control on urine had gone. She had a vision impairment. Then a lot of medicines were over the counter. They were not even prescribed. So she just had them. And she had a difficulty in cleaning. So there are so many issues. We need to handle each separately. So we tried to obviously involve the family. So how did we do that? We basically we talked to her daughter. We said, you have to help with the medications. For the gait and balance, I assessed her and then talked to the physiotherapist, gave her a balance assessment. Osteoporosis were treated with medicines. For her memory impairment, we evaluated with dementia. For dementia, we thought that we can sort of assess her again and see. Then incontinence of urine was treated. We reduced the amount of water she takes the entire day. Vision impairment was fixed, which is very important. If she can't see, then there is a great chance that she'll fall. And all the unnecessary medications were just discarded, and she got help for cleaning. Now, after 2 weeks, or after a month, actually, she came back to us. She was doing fine. Her daughter was helping. So gait and balance had got better. And she was no longer rushing to the bathroom. So she was not having any issues with that. And we discussed with her and the family that we need to make sure that her memory is okay. But at the same time, we need to see that keep assessing her so that it doesn't get worsened. You need to be prepared that she can't be alone. So she needs some support. Now, this was, of course, one example. If I have to quote another one, it was a 95-year-old who actually was doing well, but she had an abnormality in her heart, for which, unfortunately, she did not notice it immediately. So by the time she noticed it, it became bad. She was breathless, so she had to be operated. And post operation, she actually had a bit of loss of, you can say, her blood supply to her feet. So it got blocked and she lost sensation and she had to go for an amputation. So just around this time, she went really into delirium. By delirium, I mean she didn't know what she's talking. So that is when we were involved. So what we tried to do is we cut off all her medicines which were making her sleepy. We made sure that we got her into more of a better diet. We also made sure that she was oriented. We got to know through a social assessment that the son was very supportive. So we told frequent visits by the son. So she has an orientation to where she is. And slowly and steadily, she was able to recover and got out of the hospital. Now, the biggest happiness we got is when she came back after a month to the OPD and she put an artificial limb. And she said that the last time when you saw me, I was actually lying down, and now I am able to get up from the wheelchair and actually able to say that actually I can even walk. So that is that sense of, you can say, satisfaction that you actually get when you make a difference in an older adult's life.
Well, Dr. Prem, in social circles, we often hear the term successful aging. We hear of living gracefully. Well, to my mind, aging is aging is aging, you know. So what exactly is successful aging? What really does that term mean?
Yeah, as I said, in the assessment part itself, we try to promote wellness, independence, so improving quality of life. So when we go into successful aging, unfortunately, there's always been an obsession of anti-aging. There has always been an obsession of looking young or getting younger. I don't think that's what older adults want. Older adults want to live longer but age better. So I think graceful aging or graceful living and aging gracefully and successful aging is matter a lot. So what is successful aging? It has got certain principles. One is, it is avoiding disease. So you have to avoid disease or disease related disability. So it could be any disease which causes disability. Second is active engagement with life. So you want to be engaged. Every older adult wants to be engaged in every possible way. Maintain a very high amount of physical function and at the same time a mental function. So if your memory is fine, if your mental function is fine, then you will be able to do most things. Now, another thing is, all these things can go a bit haywire at some point. So for successful aging, what a older adult wants is, I am able to manage my home where I live. I want to maintain my life and sense. So basically be actively engaged, try to have a good social life, optimize your health. But if something goes haywire, I still have a support system so that I am able to sort of count on them rather than only thinking that it will not, something will go wrong. So there are three pillars of successful aging. I think that is very important. When we look at a glass of water, we shouldn't see half a glass of water. We shouldn't see that we can see it as half full or half empty. So we need to concentrate. We always obsess on thinking, oh my God, I can't do this, I can't do that. If I had a better health, I could have gone to and done this. But instead of that, as older adults, and many older adults do it already, focus on what they still can do. So you should focus on what you still can do, optimize those things, make it stronger, and ultimately use strategies to overcome the weakness. So that is something known as selection, what a person you can still do, optimization, which means improving or strengthening such things, and ultimately compensation, so that you can compensate your weakness by making it stronger. If I have to quote an example, uh, there was a famous pianist, Albert Schweitzer, who actually was doing very well, but then uh, he developed Parkinson's disease, which, people can have difficulty in walking, they get slow, they get tremors. So ultimately, people were like, "Oh, now he's got Parkinson's. I don't think he's going to play a tune ever again." But he didn't stop. So people were so wondering, and they actually went to the concert, and then they realized that he was playing only those tunes which need tremors. So that is known as successful aging. Try to optimize your function and try to do even more. Another living example, I mean, by living, he's no longer there, but for us, he's a great example, is our ex-president, I think, APJ Abdul Kalam. Even on the time that he actually died, when he had a heart problem and he died, he was actually doing something which he wanted the most, that is teaching children. So that's what he did. So that is an epitome of successful aging.
Dr. Prem, let me put to you two different questions that worry me at this moment. The first one is it compulsory for somebody who is a senior citizen to actually see an elder care specialist at the age of 60, irrespective of whether he has symptoms. It is possible that somebody who is on or around 50 or 60 or 65 could be completely healthy. But is it still advisable for somebody without any symptoms to visit elder care specialist? One. And the second thing is, what should an elder person, all right, bring along with him? What should he carry with him when he has to see a geriatrician or an elder care specialist? Is there some prescribed stuff that he needs to bring along with him or her?
Okay, so I feel that every older adult, yes, should visit a geriatrician or elder care specialist, even if they are fine. The reason being, there are a lot of things that affect your health, as I showed you. So you need to know at a baseline through the assessment that you're fine, that your mental faculties are okay, physically you're fine. We always tend to feel that if we go to a doctor, we might end up finding something. That's not the case. Ultimately, you need to find something if there is a problem, and find it earlier the better. I mean, we used to see those movies in which the usual dialogue, unfortunately, of most doctors is "aap pehle aate the." If you would have come earlier, it would have been better. I mean, that life doesn't work that way. But what we need to do is make sure that we are able to optimize your health. We know that this was the assessment 10 years ago. So after 10 years, after, if there is an issue, that we have a baseline saying, no, this was normal at that time, but these are the things which are getting. So that's why geriatrics is a continuum of care. What you were 10 years ago, I'm hoping you're still that 10 years ago. So you might have to visit me less frequently. But if things get bit problematic, and any of your domains, whether it's depression, whether it's cognition, whether it's falls, whether it's urinary incontinence, is getting affected, then help is available wherein you can actually see your quality of life is not getting affected. So if you see continuum of care, as I said, hospital, whether it's OPD or inpatient, home, that is another where, then the community. So ultimately, I want you to be back into the community and stay there, stay that way, so that you don't need to come to the hospital. So if you obviously have problems like a history of falls, if you have constipation, if you have a history of multiple diseases, multiple drugs, then end of life, history of cancer, maybe needing assessment, then all those things you should definitely consult with an elder care specialist. One is you will get time in a detailed evaluation. At the same time, there is a holistic way wherein elder care specialists look at you and make sure that a coordinated effort is done with other specialties also, if it is needed. Then as far as taking things to an elder care specialist, or you can say a geriatrician, is concerned, is, I mean, let me be frank, most older adults are very, very organized, and they usually always take things into perspective before they visit a doctor. But still, I would always want you to have your detailed past medical history, have a list of all your medications, have your glasses, prescription glasses. We always tend to forget that when we visit the doctor, we still need to take it, because if you forget that, if you have an issue also, we might not be able to help you. Then your hearing aid, because you need to hear. And if you're having a problem with that, don't avoid taking it to the doctor, because if you take it to the doctor, then if you need to modify it, then we can do it. Then one of the most important things I feel is your teeth. If you have artificial teeth or dentures, bring them along. I know you might be wearing it only while eating, but if you have any issues like pain while chewing, using them, at least that can be corrected. Names of the doctors who you're already seeing, because that will help me in giving a perspective, discussing with them whether these things need to be done again, or these things need to be looked at from a different perspective. And of course, notes on your detailed family health history, because I should know, for example, if the family history of cancer, then you might also be at risk of it. So I need to take that into consideration.
Oh, well, Doctor, you have shared so much of stuff, a lot about senior citizens and how they can really live gracefully. Would you have any specific message to the younger generation, to the caregivers, the ones who are taking care of the elders out there? Any specific message or any specific responsibility that you would like to sort of specify for them?
Yeah, I think older adults are basically taken care usually by a team, and that team includes the older adult themselves and of course the caregiver. the caregiver is very, very important. A lot of times it might be a 90-year-old taking care by an 85-year-old. So we need to take care of the caregiver here as well, because if the caregiver collapses, the older adult might not be taken proper care at all. From a younger caregiver's perspective, I would say it's always about good communication. You need to communicate with older adults. They have their challenges. They might have a vision challenge. They might have a hearing challenge. They might not be able to see or hear properly. So you need to be very soft. Try not to be always intimidating. Never say the quote that you are behaving like children. No, they are not children. They are very much older adults who have experienced everything in life. So as caregivers, we need to draw on their experience. For example, even in COVID times, a lot of older adults actually were very encouraging, although they were isolated themselves. But they were epitomes of, you can say, recovering out of issues, because this will too pass, is what most older adults told me. Why? Because they have seen so much, maybe financial issues, personal issues, professional setbacks, but everything has been overcome by them. So if somebody is living till 80 or 90, they have done something right. So we as caregivers should try to learn from them. Of course, if you are taking care of older adults who have maybe dementia, who have a lot of multiple issues, there can be a bit of caregiver stress. So please take care of yourself. Don't forget yourself, whether it's joining support groups for caregivers where you can lent out your frustration. Not only for that, get new ideas how to take. Sometimes you might have to replace yourself. By replace, I mean take help by professional caregivers so that you have a break. Remember, you can't take care of, there is only 24 hours in a day. You can't take care of a person 36 hours in a day. You can't. You have to split yourself and basically take care of yourself in a very good way. Secondly, remember, as they say that everything that comes goes. So I mean, and everything that goes comes. So it's just a life cycle. As it's a cocoon, it's a caterpillar, it's a butterfly. But as younger individuals, you will get old too. So more than anything, for the selfish reason, to take care of yourself, you should know about aging well, not because you have grandparents and because you have aging parents, but you have to age well. So you need to make sure that you inculcate all that in yourself from a younger age. So learn about aging more, because you need to take care of yourself in that selfish motive, rather than only thinking that you have aged parents. So as caretakers, as younger individuals, focus more on health, focus more on lifestyle, better communication, and ultimately work as a team with older adults, rather than thinking we are two individuals who are taking.
Well, Dr. Prem, it's about an hour that you've been speaking on right now, and probably the right time for us to take questions from our viewers. But before we go further, thank you so very much for that very, very enlightening session. We will now take a short break. We'll take a short break, as in we will continue to stay on out here. We have an important announcement. You've enlightened us so much, Doctor, today. We have heard of pediatricians for children, but this morning we have learned a lot about geriatricians as well. So really, really very informative session. I'd like to remind all our viewers at this point that if some of you still have any questions, please feel absolutely free to go ahead, put down your questions. Doctor will answer your questions right away. Our control room will pass these questions across to my control room here at my residence, and then we'll pose these questions across to Dr. Prem. Before we get on to our questions, ladies and gentlemen, we have a few important announcements. In fact, one great big important announcement. On the 18th of July 2021, we will have our third virtual live talk show under the Knowledge Worth Having series. Now, the topic for this live show will be mistakes in communication, local and international. And this session will be held live on Sunday, the 18th of July, 2021 at 11 a.m. sharp Indian Standard Time. All right, this will be streamed live on the Catholic Gymkhana YouTube channel. The speaker for the session will be the very eminent Mr. Walter Vieira. For those of you who may not know, Mr. Walter Vieira is the past chairman of the International Council of Management Consulting Institutes, which is a world apex body. Mr. Vieira is also an author of 16 books, an international speaker, a visiting professor, a business consultant, and I can go on and on, ladies and gentlemen. As we learn to travel more and more locally within the country as well as internationally, it becomes imperative for us to understand and respect one another's customs, beliefs, attitudes, values, and even traditions, for that matter, even dress styles, eating habits, so on and so forth. Mr. Walter Vieira will share anecdotes and personal experiences of how behavioral ethics or etiquettes and cultures and moral values can vary across the country as well as around the world. Ladies and gentlemen, I would suggest that you have a great breakfast on that day and get ready for Walter Vieira's. He has a brilliant sense of humor. So be there on Sunday, the 18th of July, 2021 at 11 a.m. sharp. We will now move on to our questions, Dr. Prem. How many do we have? My control room seems to suggest, or they're busy writing down questions. There seems to be a flurry of questions all of a sudden, but I have 4 readily available with me right now, Doctor. I'll take on the 4. As we speak, we could probably get some more as well. And let me start off right away, Dr. Prem. Which medical care should take priority? Now, I presume this question means that the current medicines that I'm taking, or the ones that you would prescribe now, which medical care should take priority? That's what it says, Doctor.
Yeah, so ultimately, if somebody comes to me, I obviously do a detailed evaluation of your medications. So I'm a person who would want to remove medications which I feel are not important. And it's not always necessary that medications have to be added. Sometimes they have to be substituted. Sometimes they have to be just changed, or sometimes the doses have to be changed. So ultimately, by changing a medication dose, it is always going to be for your betterment. So I wouldn't say you can say it's something new or something old. What I would want to do is modify. If I feel everything that you're doing is fine, then I'm not necessarily going to modify everything. But wherever I feel an input can be given, that would be changed. That's how I sort of work in. So yeah, I mean, depending upon what medicines you are, maybe a slight change might be made, but it all depends on case to case basis, to be very frank.
Well, 3 more questions here before me, Dr. Prem. The first one goes here. As a 73-year-old man, I have been doing 30 minutes brisk walking for 12 to 15 years. Wow. Last few years, I have also done some push-ups, squats, lung exercises, and light weights as well. Brilliant at the age of 73. What exercises are okay and what are not okay for a senior citizen who's 70 and above?
Yeah, actually, by judging by the fact that you're doing all of this, I'm sure you're very fit. Secondly, every senior, as I told you, every older adult is different. So for example, if you have any specific diseases, like if you have any cardiological ailments and your heart is not pumping very good, then certain exercises might not be done. So it's again, the exercise regimen is individualized. If somebody has a balance problem, then I would also give them balance exercises. There is also something known as Tai Chi, which sort of improves the balance to a great extent. But in general, if you have to just generalize, then it is said that for having a healthy lifestyle, with, of course, you can say a big star on it, the star saying that every treatment will be modified according to your conditions, that at least 150 minutes of walking per week is good for a healthy lifestyle. Then again, if you have bad knees, then you can't do a treadmill. So there are, and if you have any rhythm disorders, you can't do. So it's specifically, it might alter, but in general, 150 minutes is actually pretty good. And that's what has been heard to a certain extent during the pandemic. So I would say sitting is the new smoking. So if you're at home and not going out, please try to still move around in your house. Some people might say the house is not big enough. So maybe just try to move front, back, front, back. If you were taking 10 rounds down, maybe you'll have to do this 20 or 30 times, but make sure that the exercise is going. What we have seen is exercise is important because muscle loss tends to take place as you get older. And if you don't keep continuously exercising, I mean, to be very frank, there will be receding in the muscle loss. Your bone health will get problematic. and an impending fracture, if it happens, then that is when the discovery will be done. So I think in general, a healthy lifestyle, for a healthy lifestyle, exercise is very good. Specifically, your conditions matter. If your diseases hamper certain exercises, then those will be taken into fact.
I like that. I like that phrase, Doctor. Sitting is the new smoking. I really love that. All right. For all those of you who are sitting at home doing nothing, please remember you're smoking indirectly. All right. Ladies and gentlemen, we've got two more questions from our audience, Doctor. The second last question coming across to you. For those of you in the audience or our viewers who would still like to present some questions to Dr. Prem, please feel free, hurry up and do that before it gets transmitted on to my control room out here. You can do that right away. Our second last question, at least in the way I have it right now, is how do we address the cognitive and psychological changes experienced by our senior adults?
I think it's an excellent question, purely because I hope it's not only because of the pandemic that it is coming out, because mental health somehow has always gone into the background. I'll quote you an example. If somebody has a heart disease and you have a heart attack, you have chest pain, it's an emergency. You go to the casualty, you'll get your ECG done. If everything is okay, you'll come back. If not, you might have to consult a cardiologist. But if somebody is feeling low and there is no expression of the same, first is the older adult themselves might feel, no, I might recover out of it. It's just a part of aging, maybe. Then he tries to talk to maybe relatives. They might be like, yeah, it's going to be fine. Don't worry. But if it continues, you should seek help. And that is where we sort of tend to not do it. So as far as your, both are different. If let me take cognition first. Memory is very important in anybody's life. Nobody wants to get the dreaded Alzheimer's. But again, every memory loss is not Alzheimer's. With age, certain things might actually happen. You might forget certain names. Once or twice, you might just keep your keys here and there. You might just forget certain finances. But if it's happening very, very frequently, get yourself tested. By testing, I mean there is a scale which we usually do. We can know whether you are at risk of it or not. And if needed, of course, certain investigations. What I need to tell you is, if memory loss is not always permanent, there are certain reasons by which it can be reversible also. So don't worry about everything being Alzheimer's. At the same time, if you have certain memory issues, please make sure that you are able to take care of it. And how do you take care of it? When we were children, we always used to write everything down. So maybe continue doing that. Give yourself memory aids, reminders on the phone, reminders if you have a smartwatch, or reminders just on your diary that these are my things which I have to do if you're tending to forget. So practice it more, the more, and write it in maybe two different places. One is also in the computer, one is also maybe in, because more and more older adults are tech savvy as well. So it's not that they are not tech savvy. Earlier, if you remember, you used to have just books with numbers for your contacts. Now, if you just lose your phone contact book, you're like, oh my God, I don't have any of the contacts. So make sure that you are making that book still, so that you have in your mind that these are the numbers. Earlier, people, there was no caller ID also. So people always had to, in the older phones, actually put the numbers. So it was automatically that you were getting to know what you're this. So if you have any kind of memory loss, do not get scared of it. Try to get yourself tested, and we will try to obviously see what are the causes and handle it. Now, psychological aspect, I think, is very, very important. Do not feel that all these years I have not needed any help. I have been an independent person. So it's very normal that there might be a bit of low mood, and if it continues, then you can seek help. Whether you, and you need to express it, whether it's writing in a diary, whether it's telling your friend, whether it's telling your family, whether it's telling a doctor. It can be a geriatrician, it could be a psychologist, whether you need medications or not. Now, the taboo shouldn't be everything is, oh my God, I'm going crazy, or I am actually a psychiatrist is already a taboo. If I go to them, then what? Who will say this? See, ultimately, your health is paramount. So you need to take care of your health. And if your physical health is bad, then your mental health goes bad. If your mental health is bad, physical health also goes bad. So you need to be fit in both ways. That's why do not shy away from getting help. I think that is one of the most important things. And sleep. I think sleeping is very, very important, especially in the night. If you sleep sound, then most of the things do improve. Again, you might say, doctor, it's easily said and done. There are so many thoughts. Sometimes you're thinking just before sleeping. A lot of people have urinary issues. A lot of people have gastritis. So all those things handle. Sometimes you only concentrate, no, I'm not getting sleep. What is the cause of you not getting sleep? Whether it's a mental issue, whether it's a physical issue. When we address that, then we are obviously able to help you better. Another thing, if you remember, we always used to be said, at least my grandparents always told me, or others also I've heard, is that sleep early before an exam. Now that is not because good sleep will just suddenly make you a very good student. No, it's because whatever you have learned, all that memory gets consolidated. So on a larger picture, if you're not sleeping for days or months together, your memory is going to get affected. So sleep is very important for reorganizing those memories and try to sort of get into that. Another thing people always tell me is my memory is fine because I remember everything from 1950s to 1940s. But what you're forgetting is important. If you're forgetting what happened yesterday, then that is very crucial for me. So things like that matter. Do not get scared if you're having a memory loss. Try to seek help, and then we are obviously there to help you. Do not always think it's drugs. There are other ways also to improve your memory. Self learning. See, brain gets bored very, very easily. So give yourself new skills. This time in the pandemic, more and more people have actually tried to acquire skills. Online courses are there, offline earlier also, whether it's gardening, whether it's crafts, whether it's learning a new language. Try to make sure that you are able to give the brain a challenge, because if you don't give a challenge, then the brain gets pretty bored. So that also helps in improving your memory.
Dr. Prem, I have three more questions here before me. And, there is one comment as well which says, thank doctor for the very practical, helpful tips. This is just one of them that came in as a part of the question list, but there are any number of compliments floating in, any amount of good words for all that you have shared this morning, doctor. And I will not go through each of them by name, but many of those coming in. I'll keep that aside for the moment. I will carry on with my fourth question, which is three more to go, doctor. Doctor, could you suggest a list of supplements which is a must for daily use? And is there an ideal diet for a senior citizen?
Okay, now as far as list of supplements is concerned, I wouldn't say that everybody needs a supplement as far as your tablets is concerned. The reason tablets are supplemented is depending on your diet. For example, if your diet is not giving you enough, then tablets should be supplemented. So it's not fixed again for every person. No, these are the things you should take. But calcium and vitamin D is something which we sort of ignore a lot and discover later. Once there is a fracture, then the bones are so brittle that healing obviously becomes a problem. So bone health is important. So calcium and vitamin D is one of them which you should take. Then a lot of times people take some multivitamins. Remember, if it's only adding to your pill burden, it's not always needed. Try to supplement yourself with diet, which is the most important thing. Now coming on to specifics on diet. Every older adult again becomes different in this case. If you have a renal problem, your diet will be modified. If you have a cardiac problem, your diet will be modified. But in general, it should be something which is known as a rainbow diet. A Mediterranean diet is also very good. Have plenty of greens, uh, green leafy vegetables, fruits, nuts. These are very important. Try to cut on very high sugars, like too much of carbs. Uh, Too much of caffeine is also not good. Cut down on your alcohol intake. Uh, Make it more lesser. Then have adequate fluids. We always talk about diet, but having an adequate amount of water is also very important, because as you get older you will not be able to sort of have that thirst, because your thirst sensation goes a bit down as you go older. So that is also something you should make sure. I tell everybody to have that 1 liter of bottle and make sure that you're actually completing it rather than only putting it up on your thirst. Then another important thing as far as diet is concerned is, you might give you the best possible diet only to realize that you don't have teeth. So I think the presence and absence of teeth matters a lot. Whether you are having good teeth, are they your own teeth, are you able to chew? So that changes things. For example, if you're having a predominantly, if your teeth are okay, then chapatis can be included, things that like nuts can be included, things that you can chew. But if your chewing is a problem, maybe we'll have to change it into more of a semi-solid. So it is modifiable. But make sure you have adequate amount of proteins, good amount of water. Make sure that you don't have too much amount of carbohydrates. Usually in the night, the diet can be comparatively lighter. Diabetics have to be very, very important that you eat regularly, maybe in every 2 hours, rather than just those big meals, because the sugar going low or high, both are an issue for me. And ultimately try to keep yourself, everything works. So with a diet, you should also have good amount of physical exercise. Medications come later. Remember that ultimately it's not the medications that work magic only. Medications with diet, with your lifestyle, with your exercise is what helps you getting more healthy.
Each time I tell you this is the last or the second last question, Doctor, I get some more coming in, but you're most welcome, viewers, to keep your questions going. We will try and accommodate as many as possible. Go ahead, note down your questions, send it to our control team, who will pick it up from the Google chat, or rather from the Catholic Gymkhana YouTube chat, and we will certainly try and accommodate them. Next question coming up, Dr. Prem. It says, Dr. Prem, are issues like Alzheimer's hereditary? Are they hereditary?
Yes, there is definitely a gene which has been discovered which is predominant for Alzheimer's. So yes, it can be hereditary. It's not necessary that because somebody in your family had, you will definitely have it, but there is a risk. So that's why we obviously say that you should sort of get yourself checked as far as memory assessment is concerned. So you might argue that is it going to come immediately? No, but we need to keep changing. It's always the case, the earlier we diagnose, the more we are able to sort of take better care, because with, especially with Alzheimer's, sometimes it progresses rapidly, and then later it becomes difficult because as far as the medication cabinet is concerned, not a lot of medications are available. But yeah, if there is a family history, then you should definitely sort of get yourself checked. So yeah, it is hereditary. It can be, not always. I mean, let me add on that.
Okay, Doctor, the next question coming up. Is it advisable to do a full body check? Is it advisable to do a full body check for senior citizens?
Again, an yearly health checkup is always good. The reason being two ways. One is, of course, if anything has changed, then we are able to know that whether something has gone wrong, or if everything is same, at least you have that mental satisfaction that everything is going well. So a yearly health checkup, of course, with specifics, for example, to your disease. If you don't have a disease at all, then of course once a year with certain investigations, whether it's your echo, your ultrasound, that can be important. Now, screening, why it should be done is because prevention is always better than cure. So you have to take care. If your blood pressure is not there also, that has to be monitored. Sugars have to be monitored. Then cancers, especially, if you don't screen for them, you might not detect them. Then memory, again, presence and absence of depression. So if in a yearly health checkup you are like, oh, I don't have any problems, but sometimes leading questions are asked and then you realize that there is a bit of low mood as well. So I think for your general baseline of health to continue, yes, a yearly health checkup is important.
I have a last question coming up here, Dr. Prem. It says, are there online or offline courses? And now this is a new terminology for me. It says gerontology. All right. Are there, and I think this is a study of old age and things like that. All right. So are there online or offline courses that are available in Mumbai today?
Yeah. So as far as gerontology is concerned, that is study of aging. And geriatrics is the clinical part where we actually know about aging and we practice in treating aging related abnormalities, and of course the disease. Now, yes, for gerontology, yes, Tata Institute of Social Sciences, in fact, has a course of gerontology, and one of our you can say one of the older adults which I know, Mr. Madhav Purohit, he basically is in Kandivali. is one of the oldest people to graduate from there in gerontology. He did it after 70. So basically, there is no age for learning. So if you want to pursue anything, you want to study about aging, which it is, you should go ahead. And of course, offline, I mean, online, there are a lot of courses from abroad, which of course you can look up and you can do. But yeah, studying about aging, knowing about those things is might make you look into a new perspective at your own aging, and at the same time you can be an inspiration to others also to sort of take up learning. So I think, yeah, that's about it as far as gerontology is concerned.
Thank you. Thank you so very much, Dr. Prem, for addressing all of those questions from our viewers. Having concluded our question and answer session, it is time to move on to the vote of thanks. Last month, ladies and gentlemen, we had our very own managing committee member, Mr. Ian Pereira, who proposed the vote of thanks. He did a brilliant job last month when we had the talk. This month, we decided it had to be Ian once again. So, ladies and gentlemen, please welcome our managing committee member to propose a vote of thanks, Mr. Ian Pereira, please.
Thank you, Sanju. It's been a brilliant session, and I'm sure we've seen the comments. I've seen the comments on YouTube, and we've had more than 135 people on the show, and they've all benefited, I guess, from this. You know, the irony here is that the two gentlemen speaking today about people above 60 are actually under 60, and it's, I guess, apt that I am over 60 and enjoying life that I am proposing the vote of thanks. Doctor, it was very informative session, nice slides, very simple language, and lots of people understood it. And I'm sure everyone, including myself, is going to benefit. And I think I'm fit, but I think I can get fitter following some advice of yours. You know, they say that you should invest in money from the time you're 30, and then by the time you're 60, you've got a good corpus and you're financially secure. The same goes with medicine, I guess. If you start investing in your health at the age of 30, by the time you're 60, you'll be fit and fine. So there's a thin line between living and existing, and you want a long life, you got to live, not just exist. And doctors' inputs have helped everyone. I'm sure we'll all live long lives and enjoy it as well. Now coming to our host, a talk show host, Sanju. Sanju, as you know, is the treasurer on the Catechism Committee, Managing Committee. He's also got his own training and consultancy firm, and also compares events. But this is a new medium, and from talking to an audience to talking to your telephone is two different things. And Sanju's adapted very well and asked the right questions, and got the dialogue was very interesting. To ask Sanju to collect questions and to talk would be too much, so we asked Aubrey Chatelier, who's based in Pune and who is privy to the YouTube channel, to pick up the questions from there, combine the common questions and pass it on to Sanju's control room. That's his wife Nirmala and his daughter Crizel. So thanks to all three of them for making the Q&A session so smooth. And we've had these good viewers, and getting good viewers means good promotion. And thanks to our chairperson of our communications and PR committee, Yvette Malgi, and all the others who have promoted the show. Thank you all for being here today, and we'd like to see you again for the next show. Doctor, thank you once again for this brilliant talk. I'm sure on a Sunday you'd like to chill after a heavy week of work, but thank you for spending this time with us. Thank you very much.
Thank you very much, Ian. Ladies and gentlemen, we were always aware that Ian's attractive posters speak volumes for the messages that he puts out. But now we know, and we have also discovered, that his tongue is equally effective. Thank you very much, Ian Pereira. I must say that was a very, very comprehensive vote of thanks. In addition to taking care of our posters, Ian also happens to be the secretary of the Public Relation and Communications Subcommittee, along with Chairperson Yvette Malgi, and the two of them together do a lot to promote our events. So thank you so much, Ian. Ladies and gentlemen, before we can say goodbye, I think it's important to remind you of two important functions coming up. Our next live talk will be held on the 18th of July 2021 at 11 a.m. sharp. That's our third talk show. We also like to remind you that every Saturday at 9 p.m. sharp, all right, we bring you the Members Night, which is a live band from across the country that performs for you at 9 p.m. We'd like to see more and more of you joining in both these virtual programs. They have been absolute hits, both the talk shows as well as the Members Night. Before I say goodbye, ladies and gentlemen, I would like to leave you with a thought. A thought first to all our senior citizens. Our senior citizens, age is not a number. Remember, eventually it is your attitude that will dictate your age. And to our younger generation, there is something that I have for you to think about as well. To care for those who once cared for us is one of the highest honor. Let us execute that honor. With that, ladies and gentlemen, this is your friend and compere, SANJU Fernandes, saying thank you, goodbye, good afternoon, and stay safe.
Thank you.